Hello and welcome to today's virtual media conference to apprise you of government's efforts to combat COVID-19. Joining me today are the Minister of Health, the Honorable Terrence Deyalsingh, and Dr. Avery Hinds, the Technical Director of the Epidemiology Division at the Ministry of Health. The Minister of Health, the Honorable Terrence Deyalsingh, will now give an update on COVID-19 in Trinidad and Tobago.
Thank you very much, Minister Cox. Good morning to the media. Good morning to Trinidad and Tobago, all persons who are listening in with keen interest. Ladies and gentlemen, today is Monday, and it is the start of a new week. It is my hope that this new week could bring a renewed sense of purpose, a renewed sense of vigor and energy to keep everyone safe and to save lives. It is my hope that a new week brings a new purpose, a change in attitude, as we work together with the health sector to protect healthcare workers from not having to treat too many cases. Before I get into what I wish to speak about, I need to address the usual social media gremlins that are hard at work trying to confuse the population, spread misinformation, and mischief. Yesterday, a decision was taken to put out a new regulation which allows for the opening of hardwares, electrical businesses, and plumbing businesses on a Monday, a Thursday, and a Saturday from 8 a.m. to 12 noon. These three types of businesses, hardwares, electrical stores, and plumbing supply stores, will be allowed to open on a Monday, Thursday, and Friday. Monday, Thursday, and Saturday from 8 to 12. Some on social media hijacked, again, the Ministry of Health's letterhead, and then, in an effort to cause panic, included pharmacies and groceries. Let me state categorically, it does not apply to pharmacies and groceries. Citizens of Trinidad and Tobago will have access to the full gamut of medical care, including pharmacies, will have full access to food, including supermarkets, throughout. There is no closure order for pharmacies and supermarkets, and I urge the population to ignore that social media post. Ladies and gentlemen, in dealing with the COVID-19 pandemic, it is important for us to revisit some data and some graphs, which I will now ask to be put up as I walk you through what this graph means. It is a graph on the left-hand side in blue, the total number of cases in the world, and on the right in orange, the total number of deaths. We have been saying, do not misinterpret our data to mean that we are in the clear. If you look at total cases in blue on the left-hand side, starting from January 27th, I believe it is, you would see a slow, steady increase in total number of cases from January 22nd. That more or less mirrors where we are. Slow, steady incline, which we can cope with easily. However, from around March the 7th to the 16th, what you started to see was this slow incline, which we could walk easily without losing breath, suddenly turned into an almost vertical wall where no one can climb. Total number of cases. That is what is called exponential growth, as opposed to the linear, slow growth from January 22nd to March 7th. We are in the first stage there. We are trying to avoid reaching that wall of cases that when you look up, it reaches to the sky. Mirroring that on the right-hand side is the orange graph, which talks about total deaths. Total deaths started with the same slow incline from January 22nd, but it mirrored the total cases with a lag time of about 4 days to a week. So from March 16th to March 25th, what you started to see was this wall of deaths around the world. Ladies and gentlemen, we have had to date 8 deaths. The measures the government is applying to the society is not to punish anyone. It is to save lives. We do not want our graph to look anything like this. That is the objective. On Saturday, I would have alluded to the fact that one of the countries in the world which was considered the gold standard in how to manage COVID has now regressed. There's another country, and again, I wouldn't call the country's name, it is not to shame any country, but we could learn, that is now talking about their healthcare system collapsing. And let me explain why that is so important. One of the measures that we use to determine how robust a healthcare system is the bed to population ratio. This particular country has one of the highest bed to population ratios in the world. They have 11 beds to every 1,000 people in population, 11 to 1,000. Their second wave is now threatening to bring down that system. By comparison, Trinidad and Tobago has about 3.3 beds per 1,000. We have less than 1/3. And we are nowhere near to collapse in our healthcare system. However, if we continue to act in ways which threaten the healthcare system, that is going to be our future. Our future will be sealed because we didn't learn from the mistakes of others and we didn't pay attention to the 2 graphs I showed earlier. There's an old song, How Many More Must Die, the Mighty Duke. 8 persons have died so far. 8 families are in mourning. 114 cases, 114 families have been traumatized. Healthcare workers go out there every single day to do their jobs. That will be our future if from today we do not renew our spirit of cooperation with the measures. They are not meant to punish. They are meant to save lives. Let that not be our future as we move forward. And why? We have another chart to put up. A very simple message. There is no cure. There is no vaccine. And there is no standard treatment. Until you have a vaccine, until you have a cure, the world is going to have to adapt to the virus. And I will close by just reiterating a message I gave out on Saturday, that the world has changed more in the past 4 months than in the past 400 years. It is not business as usual. It is business unusual, with the sole objective of saving lives and saving our healthcare system. Minister Cox, I thank you for the opportunity.
Thank you very much, Minister. At this time, Dr. Avery Hinds, the Technical Director of the Epidemiology Division at the Ministry of Health, will now provide an update on contact tracing.
Thank you, and good morning to the Honourable Ministers.
Good
morning to the viewing media and to the members of the viewing public. Before we go through the contact tracing, the first thing I'd like to do is provide the regular clinical update on the cases that we have to date. To date, there have been 1,357 tests submitted to the Caribbean Public Health Agency's laboratory. We remain at 114 positive cases in total. Of those, 22 persons have been discharged completely, as in discharged home. There have been 8 mortalities, 8 deaths, and we extend our condolences to the bereaved families. And there are currently 59 hospitalized patients between Cora and Couva. At Cora, there are 10 hospitalized patients, all of whom are stable. At Couva, there are 49 patients. 1 is in the high dependency unit. The other 48 are ambulatory, walking around, stable. No one is in ICU or ventilated. And there are 25 additional persons who have been moved to the Sangre Grande Center, the Brooklyn Center, for stable asymptomatic patients. So that takes us through our clinical update. The next thing that I would like to do is to give some demographic information that we've provided some slides for. So we're going to switch to the slides, and we're going to begin with slide 1. Slide 1 shows the epidemic curve for all the COVID-19 patients. It includes both the cruise and non-cruise cohorts. The cruise cohort is the cohort that's demonstrated in orange. The non-cruise cohort are the ones that are demonstrated in green. And we can see that beside the day of the 20th of March, where we did the testing and got a large number of persons positive from the cruise, in general, we've had a fairly small number of cases each day. We can see this better with slide 2, which shows the epidemic curve excluding the cruise cohort, where it is demonstrated that we really have had a few cases a day, fewer than 10 on any given day, and this is in line with what we call the sporadic nature of our epidemic. We have had sporadic importations of cases, we have done aggressive contact tracing and quarantining, and we have done, in collaboration with the public, the social distancing that has managed to slow the potential spread of illness. So you see that with this slide, we still have a pattern that demonstrates sporadic cases. The third slide is a slide that shows the basic demographics of the COVID-19 positives to date. And we can see the age groups and genders of the persons, and the red dots demonstrate the age groups in which there were fatalities or mortalities. We note, and we have been saying this repeatedly, that in those cases where there were deaths, persons did have other underlying conditions, and the range of ages is from 55 and above. The next slide is the Geographic Information Systems map updated as of the 19th of April, showing the 114 cases where the sizes of the dots are proportional to numbers of cases in various geographic areas. And overlaying on this, we have put the fifth slide. The fifth slide is the contacts of the cases that have been mapped. And we have basically located and identified about 715 contacts in total. And those persons have been contacted, they've been spoken to, they're being followed up, their symptoms are being monitored. And this just shows the geographic distribution for both Trinidad and Tobago of the contacts, with the lines showing that not all contacts live geographically close to the index case. And this just emphasizes the importance of the measures that we have been asking persons to adhere to, where we're not moving around as much, we're not interacting as much, because Trinidad is a small place, and anyone can be in contact with anyone else just about anywhere in the country. That's the basic message demonstrated by the dispersion of the contacts shown on the graph. So that brings me to the end of my update and to the end of the information on contact tracing. We would like, however, to emphasize messages that have been given in the past regarding the importance of not taking our current state for granted. It is very important that with the work that has been done and with the cooperation that we've had from the population, that we maintain focus, we renew focus, and we continue to remain at home when it's not necessary to move around, and that we do the social distancing, the hygiene, the disciplined activities that we've been advocating from day one. With that, I turn it back over to the ministers.
Thank you very much, Dr. Hinds, for that very important information on contact tracing. Members of the media, the floor is now open. Remember to identify yourself and the media house you represent before posing your question. We want to give as many of you an opportunity to pose questions to us, but that means in our limited time, we will have to give each media house a chance to get a maximum of 2 questions in. And once we have completed the pool and time allows, I will come back to you. And let us keep this in mind as we begin taking your questions. 98.1.
Minister Deyalsingh and Dr. Hinds, as well as Minister Cox. In your frequently published releases
Could you identify
or
yourself,
updates
please?
on COVID-19, there was a noticeable change. There was a noticeable.
Could you identify yourself, please?
Thanks, 98.1 FM. Yes. In your frequently published press releases or updates on COVID-19, there was a noticeable change yesterday in one of the releases in the way that the data was presented. For example, included yesterday was the mapping of laboratory confirmed positive cases with some basic demographics. Is it possible to have a category showing gender breakdown of males to females affected from the point of testing to that of being discharged? Can this be provided as part of the statistics update?
Once the CMO is okay with that, I will have no problem with it, but I will certainly ask the CMO if that could be included. Thank you, Mr. Cummins.
Thank you. We move to Express.
Good morning.
Good morning.
Am I there? Morning, ministers. Thank you, everyone.
Morning, Kim.
Minister Deyalsingh, I would like to ask you something that I may have asked of the National Security Minister, but I'm still going to try to ask you as Health Minister. The 33 persons who are still in Barbados, we know that the Minister of National Security is the person to grant their exemption. These persons are still there. They are persons of middle age and above. And I just want to ask you as Health Minister, some of them may be experiencing stresses upon their health as a result of this, this prolonged stay in Barbados, the uncertainty. Is there anything you can share with us from your perspective to their situation and what's happening with their coming home? They were all set to come home. They were kept back a bit through no fault of their own. Also, Minister, if I could ask you quickly, hardware restrictions, there are further restrictions because too many people are not adhering to government's guidelines. And I want to ask, if we are at a crucial point in this curve system that COVID has been presenting with, are you concerned that enough people are ignoring the guidelines to threaten us? And if that is the case, where we make more recommendations in terms of maybe stricter lockdowns so that we could get through this?
Sure. Thank you, Kim.
Sorry, I'm so sorry.
Sorry, I didn't get the last part. Kim, could you repeat the last part? We lost you there on the very last part.
Sorry, Minister. Was it the part with the hardwares?
Yes, after that. You were saying something and we lost you.
Oh, well, it was to say that we're seeing further restrictions on hardware.
Okay, right. Okay. So the issue of the folks in Barbados, the CMO did say, and the Minister of National Security did say, they will get an advance, I'm using the word manifest here loosely, but the Barbadian authorities will be sending, hopefully, a detailed breakdown of the persons, their health status, so that when they land in Trinidad and Tobago, they will be medically assessed and see what best possible care we can give to them, not only coming into the country, but also to see about their underlying health concerns. So the Chief Medical Officer has a team standing by to do just that. On the issues of the hardwares, what we noticed, and I think we mentioned this last week, the Minister of National Security and myself, we monitor the situation on an hourly and daily basis. Yes, you are right. Some people are ignoring the measures. Specifically with the issue of hardwares, many people were now going into hardwares to buy paint to paint over their homes and bring workmen in to paint over their homes. That is a clear and present danger to the families living there by inviting workmen to come in to do non-essential repairs. Some were saying, let's build a garage. This is not the time for that. Visit a hardware for your emergency supplies, electrical, a pipe burst, plumbing. But what was happening with the hardwares was that many people were just browsing, buying barbecue pits and buying paint. And that is where the ignoring of a basic concept. Everybody should be able to judge in their own minds what is essential and what is non-essential. I mean, at the beginning, I think the Honorable Prime Minister said, and I said it, you can't legislate for every behavior. At the end of the day, we have to rely on the inherent public intelligence to keep families safe by staying home, and that's the message. Thank you, Kim.
Thank you. We move now to ACP News.
Harry, Minister of Health, can you, just a follow-up on Stephen's question, can you give us a time frame when you think we would be able to see in the updates actually the number of people who have been tested? One, and I have a query from someone after the ordinance was, the public health ordinance was done yesterday. He has a hardware and an agricultural shop together in one. It's registered as one company. So he's in a bit of a predicament in terms of his opening hours. I don't know if he gets some clarification on that. And if I could just ask Minister Cox one last thing, that today was supposed to be the opening of schools. And last week, the Minister of Education, he did say that he was going to Cabinet to get some more information and to get decisions on people writing exams, CSEC, CAPE, and SE. So I'm just trying to find out if it's possible for us to have the Minister of Education here some days, so he can just let the people know about exams, especially what is taking place in the education right now in the country.
Okay, so let me answer the first part of the question. As we indicated, the Chief Medical Officer will make the determination as to what information is given out, and I will rely on his expertise as a public officer. On the issue of an agricultural shop and hardware, prior, we just said you can't legislate for everything. People have to use their inherent intelligence. Hardwares are only to be open on a Monday, a Thursday, and a Saturday. That is clear, clear. I think the public health regulations spoke about things having to do with food production. If that person is unclear, he can simply contact the Ministry of Health and we will guide him accordingly. But hardwares are only to be open Mondays, Thursdays, and Saturdays, whether it is annexed to a rum shop, annexed to an agricultural shop, annexed to a parts place. Hardwares are only to be open Mondays, Thursdays, and Saturdays from 8 to 12.
Thank you very much. Prior, your question is noted, and the Minister of Education should be here sometime soon to give an update. We move to 91.9.
Hi, good morning. We're next of all from 91.9 FM in Tobago. I just have two quick questions. The political leader for the PDP via Facebook yesterday made a claim that a WASA worker in Tobago had died, and he is saying that it's alleged that the person had COVID-19. WASA, via release subsequent to that last night, said that they have taken some precautions and they are awaiting the autopsy. What I want to find out is how soon can we get some information on that and an autopsy result to find out exactly what was the cause of the death of the worker. And the second question is Dr. Wheeler in Tobago has also asked and encouraged persons to continue to donate blood, as they may be seeing some reduction in their ability to receive blood. And as normal operations of the hospital still continue, they do continue to need blood. So I'm trying to get from you do we have a similar situation like that in Trinidad with blood? And what is the procedure that could be put in place to help with persons who may need blood either on the wards or may need some kind of emergency surgery? And are we taking that into consideration as we move forward? Thank you. Good morning.
Thank you for the question. The Chief Medical Officer on this very forum on numerous occasions has said, without speaking to the particular case in Tobago, that if you have a confirmed case of death due to COVID, that no autopsy is performed. I'm just giving you that fact. I will urge everyone to ignore social media. We will be guided by updates from the Ministry of Health. I'm just giving you that fact. On the issue of blood, what we are doing in Trinidad and Tobago is ramping up, because you are right, we have noticed a slight drop-off in blood donations, and we had this discussion at the ministry last week. We are ramping up our voluntary blood donation. We are reaching out to our voluntary donors because we have their names and numbers. This is being championed by Dr. Kenneth Charles out of UWI and the Blood Bank, where we are actually phoning people on our database. We started that last week, I believe, to make sure our blood supply is consistent with the needs of the country at this point in time. And I really thank you for that question. Important.
Is there another part?
No.
95.5.
Hi, good morning, everyone. Whitfield Turner from N95.5. I just have one question here, I believe, for the minister. What help is there for ENT clinic outpatients to address life-threatening respiratory issues? I have information that there are persons who would have done tests at Port of Spain General, but they never got back those results, as the doctors are apparently engaged in the COVID response, and they are at home having issues, respiratory issues, not COVID-related, mind you, but they are wondering how soon can they get their results to know whether they will have to be on medication and so forth. Can you provide any insight into that, please?
So, could I ask, results for what? What results are they waiting for? If you could give me some specifics, I can probably look into it.
They did ENT tests, and they have not gotten back those results as yet to determine what should happen to them afterwards, because the doctors are not available.
I will ask Dr. Hinds if he's talking about biopsies. Maybe Dr. Hinds could come in here.
Okay, I'm not certain again which test, but I understand that the various investigations may be done, and that you're saying that the routine ENT investigations outside of COVID, some of those results are pending. Am I correct?
Yeah, from the outpatient clinic side, those persons are still waiting to get their test results.
Okay.
Okay, we will take note of it and speak to the administrators at Port of Spain General Hospital. Thank you for drawing it to our attention.
Guardian Media Limited.
Hi, good morning. Peter Christopher from Guardian Media. I had asked a couple of weeks ago about the delivery of or the potential for catering for essential workers. I got some questions from essential workers who are saying that they are struggling to get food while they work on shifts and such. And I'm wondering if there will be any consideration for any adjustment for certain restaurants close to some of the facilities that they work at to provide at least delivery service to them. And to go back to the contact tracing, I just wanted to find out, with regard to all the contact tracing that has been done, how many of those cases have led to tests being done that would have contributed to the overall number of samples that have been tested so far?
Okay, on the issue of food for healthcare workers, I will take that one. Most of the healthcare workers currently working in the COVID environment will fall under North Central Regional Health Authority. I shared the same concerns with both the chairman and the CEO of North Central Regional Health Authority. This is as early as beginning of last week, and they have assured me that proper meals are being provided for healthcare workers. So the issue of opening up restaurants does not apply at this point in time. I actually have the actual photographs of the food being sent to healthcare workers at Couva, Cora. In the case of the 6 nurses who are living with the patients at Brooklyn, I have had no complaints about food being furnished under the auspices of Eastern Regional Health Authority. But again, I will take your concern under advisement and raise it again, because that is critical.
Okay, and as for the second bit of the question, thank you. The process for contact tracing and follow-up does, in fact, include monitoring the contacts for symptoms, and if anyone is symptomatic, then those persons would be tested. So not all of the contacts became symptomatic, but any of those that did would then have been tested as priority, having been exposed to a confirmed case. So yes, some of the contacts that would have been identified would have contributed to the numbers of persons tested. The other persons that would have been priority and focused on would have been persons traveling into country with respiratory symptoms, and the persons who may have been hospitalized also with respiratory symptoms. So the numbers of persons tested would be a mixture of the target groups that were focused on for primary COVID-19 surveillance, and that is migrating to the wider sort of testing that has been described, looking at potential cases in the community. So we're having that added to the previous numbers and previous categories of persons who were tested. I'm not sure if that answers the question, but I hope it does.
Thank you, Dr. Hinds. Yolande Thomas.
Good morning. Yolande
Yolande.
Thomas, and Lifestyle Communications. Morning.
Good morning.
Minister Deyalsingh, I just wanted to get some clarification with regards to having spoke about the hardwares and the electrical stores. Are there any restrictions being considered for other stores who are allowed to sell at this time?
Not at this time, but the Minister of National Security and myself, we monitor this on an hourly, daily basis. And if we feel there's a threat to life, if we feel that some persons are still ignoring the request to stay at home so we could save lives, not only their lives, but the lives of healthcare workers, the Minister of National Security and myself will confer and see what other measures we can look at to keep people safe.
Thank you, Minister. Tobago Channel 5. We are not hearing you.
Hi, good morning. Candice Jackson from Tobago Channel 5.
Morning,
Good
Candice.
morning.
My question, I'm not too sure if Minister Deyalsingh will be able to answer this, but we are getting some complaints from public servants who are considered to be non-essential, but are being told that they need to come in twice a week for 4 hours a day. Also, so they're wondering, whether or not this is how it's supposed to work for them as public servants, and what's going on with the pandemic leave. How far has Cabinet gotten in introducing that into the system?
Okay, so I think this issue was addressed about what is non-essential and essential as far as the public service is concerned. I think it was the Honorable Attorney General who made the point that if we have to process salary relief grants, food cards, then a public officer has to come in and do it. So that's essential. On the issue of pandemic leave, I think the Minister of Labor made a statement today. It is carried in the newspapers, and I can refer you to that statement. I will not be able to comment on where pandemic leave is at in the Cabinet. It is not under my portfolio as Minister of Health.
TV6.
Good morning, Renessa. Renessa Cutting.
Hi,
TV6
Renessa.
News.
Morning.
Good morning.
On the issue of PPE, I know that multiple times you all would have indicated that healthcare workers will receive PPE based on their level of exposure. But But I had two doctors reach out to me, and they are not dealing with confirmed patients, but their concern is that they are not receiving any type of PPE, no mask, no, not even surgical masks. And they are wondering now, well, what types of accounting mechanisms are in place for the stock of these items, because they're not getting even the basics. And especially given some images that was circulating recently with a person who is alleged to be in charge of distributing masks using said as a bikini.
As a what?
So I'd like to know what are the accounting mechanisms in place for that, because healthcare workers are saying that they're not even getting the basic surgical masks.
I can tell you categorically that every healthcare worker has been stratified in the system, and the chief medical officer has said this on this forum more than once. You stratify healthcare workers in 3 categories: those who are at risk of high exposure, medium risk, and low risk. Everyone in the high exposure group, and there was a video on Saturday with Dr. Parkinson on how you intubate a patient, those persons will get the highest degree of PPE, which includes N95 masks, full gowns, head covers, visors, and this is a visor we have here. Actually, UWI is now producing these visors for us. Necessity is the mother of invention. We are getting 1,000 visors from UWI for those who are most at risk, and UWI must be commended. And with these visors, they don't have to wear goggles. Every healthcare worker, based on the stratification of their risk, receives the appropriate PPE. What is happening is that, as I said in this forum earlier, we have now put PPE under the direct control of the CEOs of all RHAs to make sure that the correct PPE is available to the correct person at the correct time. What you are probably hearing about is a reaction to the change in methodology, whereas before COVID, anyone can walk in and request PPE. Because there's a global supply chain problem, and in some countries you don't have this, in some countries you have to wear garbage bags instead of a overall, we are nowhere near that. And one of the reasons is, about 3 weeks ago, we put in these control measures. These control measures are there to protect healthcare workers, so the appropriate level of PPE is given to the appropriate level of staff at the time they require it. So I reject that assertion outright.
Here we move to Power 102.
Hi, good morning, Head Table.
Morning.
Hi, morning. Kimberly from Power 102 FM and Izzo Media. Minister, I have 2 questions, one for you and one Dr. Hinds might be able to answer. In terms of these step-down facilities, because I know we have also identified 2 others, one in Tagarigo and one in Davie. Are we ever going to consider having persons self-isolate at home? Or is it that when you get a positive test, you must go to one of the isolation centers? That's one question. And my second question for Dr. Hinds. Dr. Hinds, the 114 that we're seeing, the numbers of the positive cases, does that include new tests and also persons who would have been retested? Or what does the 114 represent? Thanks.
Okay, so let me take the first part of the question, the issue of step-down facilities. There was a particular lawyer who lauded the case of Chris Como, who self-isolated at home. He was on TV, on TV6, speaking about the miracles of self-isolation at home. And this person was able to continue his work on CNN. Do you know what happened in that family? His wife got COVID. His wife got COVID. In an earlier program with that same person who was lauded by a lawyer on TV, you saw his daughter running down the stairs to come into the basement on TV. That is not isolation. That is not isolation. One of the reasons that we don't have an explosion of cases as the two graphs, if we could put up those two graphs again, it is so important to understand where we are. One of the reasons is that we have been careful, we have been robust to prevent that. When you send someone home, you lose control over their behavior at home. And one person will infect a household of 4 or 5. They then infect 40 people, and 40 people infect 400 people, and 400 people infect 4,000 people. This is what we are trying to prevent. That steep incline in both cases and deaths. So we urge the population to comply with the ministry. You see that again there? One person infects 10, and the 10 at the bottom of the pyramid will go out and infect 100. That is called exponential growth. And that is when you hit this wall, and when you look up to the sky, it touches the sky, and you lose control over the situation. Isolating at home for a known COVID positive patient, or even a recovering person, that is why we have these step-down facilities. And that is why we have avoided Armageddon. These policies are not meant to punish. These policies, as inconvenient as they may, are meant to save lives. We have lost 8 lives already. We don't want to lose more. Thank you very much.
Dr. Hinds?
Okay, to answer the second part of the question, the 114 cases are 114 individuals who have tested positive. There are no repeats and no double testing within that group that we have identified. That's 114 positive persons out of all the tests that we have been doing.
Thank you very much. I recognize TDT.
Hi, good morning. Hope you all hear me clearly.
Yes.
Hi, Crystal Wilson, TTT Limited. Health Minister, is there any update on the status of surveillance testing being conducted at specific health facilities?
Sure. Thank you. Good.
Thank you.
So surveillance testing started last week, Tuesday. We are awaiting the first batch of results. The Chief Medical Officer will give us those results. However, I think I have some positive developments there. We are going to be ramping up our surveillance testing significantly from next Monday, as the CMO did describe on Saturday when he was here. We got in 1,700, Avery, is it 1,750? 1,750 extraction kits, which are dedicated only to Trinidad and Tobago, which are matched to the 4,000 test kits we got from China as a gift. So from next week, Monday, we will be in a position to ramp up in a most significant way surveillance testing in Trinidad and Tobago to find out what is actually out there. What we are doing now, we are training personnel, and then once the personnel are trained, we will have to spend some time, about 200 tests, certifying that the results we get from that machine are compatible with CARFA. Once that validation is over, that process will start. The validation is over, and then we ramp up from next week surveillance testing in the most significant way, because we got in 1,750 extraction kits. Thank you very much.
Thank you. We go back to Express.
Thank you. Kim Bodram again. Minister Deyalsingh, just to quickly return to the issue of nationals abroad.
Yes.
They are in Venezuela, Suriname, Barbados, to ask if government will consider care packages for some of these persons whose resources are low. They are in need of money, medication, other resources. Also, last week, I believe you were part of a PAHO conference of regional ministers of health. Also, one of the PAHO incident manager also stated last week that that organization was giving out something in the vicinity of 1.5 million, test kits. I think it was this week to member states, and then a further 3 million before the end of this month. So just ask if there's anything with regard to that PAHO meeting you would want to share with us. and whether or not we are going to be receiving any of those
Sure.
test kits.
Thank you. So on the issue of care packages for persons abroad, that lies outside of my realm as Minister of Health. I will be responsible for them once they land here. 2, on the issue of the PAHO report, I have the minutes here. What was discussed at that PAHO ministers meeting are the following. The issue of rapid tests for COVID-19 was discussed, and it was recommended not to go that way. The science is in its infancy. They are inaccurate. They have launched 4 clinical trials for COVID, and with the thing about testing, yes, we will be receiving a further 10,000 tests, complete tests with extraction kits from PAHO within the next 2 weeks, solely for use in Trinidad and Tobago. So, to recap, we have 1,750 tests available now. We are validating the machines now. We will start that process next week. And in about 2 weeks, we have an additional 10,000 kits, complete kits. It is the strategic objective of the Ministry of Health, and I shared this with PAHO, that in Trinidad and Tobago at any one time, we should have about maybe 3,000 to 5,000 test kits available for Trinidad and Tobago only as we prepare for the second wave and the third waves. So I thank you for your question, Kim.
Thank you, Minister. We go move back to ACP News.
Hi, good morning again. Minister, I just wanted to, we have been asking for some time if, we are going to see the number of people who are tested, and we not seem to be getting a straight answer. Can you tell us if that can be done and if it's going to be done? That's a simple question.
A straight answer was
given.
Way
I can ask the question.
Sorry. A straight answer was given over the Easter weekend. We did indicate 1,051 people at that time, so we could probably update that for you. That is not a problem prior.
Okay, 91.9.
Hi, good morning. Vern again here. Just for some clarity's sake, Minister, the situation that we spoke about earlier with the WASA worker, the claim that was made by Mr. Duke is that that person wasn't tested positive at all for COVID. It's actually a very, very clear claim by Mr. Duke. There's no proof to say that, so the autopsy still has to be done, just to clarify that. And just quickly with respect to surveillance, could you give us any kind of criteria that's going to be used for testing people at these surveillance sites? I know we are going to expand it past just travel history. Is it that somebody could come in with just a cough or a headache and ask to be tested? And also finally, Dr. Hinds, in terms of recoveries, can we get an idea how many of our recoveries have been over 60 or within at-risk groups that came out of the system so far?
Okay, I think the best way I could deal with claims by Mr. Duke is just simply to ignore it. 2, on the issue of surveillance testing, and I thank you for the question again. Surveillance testing will be done at one health center per county. It is meant to capture voluntarily people who have viral illness symptoms, for example, a fever, a cough, stuffy nose, congestion. As it has been made clear, it is not that everybody with a cough will be tested. The Chief Medical Officer on this forum several times has put out the clinical criteria as to who will be randomly tested. What does random mean? It doesn't mean anyone walks into a health center to get tested. It means people who meet the clinical criteria, they will be offered the opportunity to be tested. They are not forced to be tested. They can volunteer to be tested, and that is what we mean by random testing based on clear clinical guidelines.
Minister, that's it?
Yes.
Okay, to answer the follow-up question regarding the demographics of the discharges, at this point in time, that information is not on the desk in front of me. That information can be sought, and we can share that with the clearance of the CMO when it becomes available.
Thank you, Dr. Hinds. We move back to TV6.
Yes, I have two questions.
Sure.
I wanted to find out if the ministry has any purview over or has given any directives to private companies who supply medical services, because someone from GMR provides the ambulance services. They reached out to me and they indicated that 2 employees were actually in quarantine because they had come into contact with a COVID patient before the person had been confirmed to have COVID. But the company's policy is that they do not receive PPE unless they are dealing with confirmed patients. So I wanted to find out if you all have any purview there that you all could probably indicate to them or influence them in any way with regards to this. The second question, I wanted to get an update on the validation process by CAFA of private labs to find out how many have come forward, how many were approved, denied, etc.
Okay. So on the issue of GMR TT, I would advise you reach out to the CEO of GMR TT. They are a private company contracted by the Ministry of Health. I know for a fact that GMR TT treats infectious disease transportation very seriously, and I will be surprised if what you are saying is in fact true. I don't know. I don't have the evidence in front of me, but you can reach out to Mr. Paul Anderson at GMR TT. 2, the number of labs, I don't have that information in front of me to the best of my knowledge, and we did say if any private lab was validated, it would be made public. To the best of my knowledge, none has been made public as yet, but I will certainly endeavor to find out from the Chief Medical Officer, CAFA and PAHO, who are responsible for that process.
Guardian Media Limited.
Hi, good morning again. I
Morning.
just wanted to find out if there's been any update with regard to the Cuban nurses that would be coming to the country to lend assistance during this time. And also with regard to the testing, is there any specific target in terms of the amount of tests you all are planning to do by week or anything like that?
Okay. So on the issue of the Cuban nurses, initially 9 were supposed to come in. For personal reasons, I think 1 or 2 backed out for personal reasons. That ended up working to our advantage because then we had to re-interview, and now about 12 are coming in. The work permits have been secured. We got the cost of the flight from Cuba, and we are just waiting for the Cuban embassy to go ahead and bring them here. But we are not only relying on the Cubans for ICU training. We are training our own local nurses in ICU management, a training program. I think I spoke to the Chief Nursing Officer this morning, and that is ongoing. So we will have both locals and Cubans trained in ICU management. What is important to note so far is that, and Dr. Hinds could bear me out here, our ICU capacity so far has not been stretched. Is that correct?
That is correct.
Yeah. We haven't had too many people in ICU, which is a good thing, but that could capsize tomorrow if we don't stay home. So we really have to emphasize that this is a stay-home process. Stay home, we don't have to use resources.
Second question.
Second part of the question was?
Could you repeat the second question, please?
The second question with regard to the testing.
Yes.
Has the ministry identified a weekly target or anything like that in terms of how many tests they plan to get out?
Yeah. So the chief medical officer will start to make that determination based on what he gets back. So I wouldn't like to preempt what he has to say. He is the person in charge of that, and he will determine how many tests are to be performed. We see the chief medical officer as our chief scientist in this. He has not led us wrong so far, and I don't think he will, and I will rely on his expertise to determine the numbers.
Thank you, Minister. I go to Newsday.
Hi, good morning, everyone. Olive Gonzalez from Newsday. I have 2 questions. My first question has 2 parts. Minister Deyalsingh, I'd like to know blood donations being tested for COVID-19. Is there a possibility the virus could be contracted from a blood transfusion? And also, I realized that there were errors and readjustments to the COVID-19 updates last week. I know even though human errors are unavoidable, people tend to get tired. So I would like to find out what is the mental and physical health of frontline workers, especially those sending out information to the public.
Okay. So the Chief Medical Officer addressed the issue of blood donation and tested for COVID-19 last week. I would encourage you to relook that. I don't want to cross him on that. He's the technical expert on that, but he did indicate what is in place for the testing of blood for COVID-19. On the issue of errors, I think there was one error which was made, regrettable, and we have since taken corrective action to make sure that that does not happen again.
Thank you very much. Ladies and gentlemen, we are out of time. But let us get a closing statement from the Minister of Health, the Honorable Terrence Deyalsingh.
Thank you very much. And I want to thank the media for coming out in their numbers again this morning. As stated earlier, this is a new week. A new week, a new dawn brings new hope. It should be our collective hope that from Monday going forward, we adhere to the simple directive of the Honorable Prime Minister. He gave this country a very simple strategic statement. His objective is to save lives. We translate that simple objective into our operation, and the operation is stay at home. The only way we can save lives is to stay at home. We do not want to regress. The plateauing of cases, as I showed you earlier in 2 graphs, can change within 4 days. That is our future. That is our future if we continue to ignore the directives to stay home. Other countries who opened up too early and celebrated too early have to restart the entire process. I don't think there's anybody in Trinidad and Tobago who wants to restart this process. But if you work with the government, if you work with the directives being given out every single day, we may see some light at the end of this tunnel. But it now depends on the collective social responsibility of all 1.4 million people. I thank the media for their coverage of this and for getting this vital message through. Stay home to save lives. Thank you very much.
Thank you very much, Minister. And we have come to the end of today's virtual media conference. Do remember that the Ministry of Health and the Ministry of Communications are your only credible sources of government information on COVID-19. And we wanted to let you know that if you're feeling sad, stressed, confused, scared, or even angry during this time, do not worry. You are not alone. But the answer is not to break isolation and carry on with business as usual. You need to follow the public health guidelines to stay at home, even when you feel overwhelmed by these emotions. Just remember that staying home will save your life and those of others. I am Donna Cox, Minister of Communications. Thank you for joining us today as the government continues its efforts to flatten the curve and beat COVID-19. Stay home. Stay safe. May God bless Trinidad and Tobago.